Hello and a very warm welcome to Hair on Air podcast series. I'm your anchor Pooja, and today we are going to be touching on a very burning topic of hair loss. I'm sure you all would agree that you would have experienced some hair fall or hair loss at some point in time. But today we're going to be talking a lot about debunking the myths around hair care, around hair loss, and helping you relive that beautiful hair back again. I'm sure it's your dream to have that lost hair back again, but how are you going to achieve it? We're going to help you achieve it through our very renowned doctor who's going to be joining with us today. Today, we have amongst us a very renowned an expert hair transplant surgeon and trichologist, Dr. Sumit Agrawal, amongst us from Mumbai. Dr. Sumit, please welcome to our show Hair on Air podcast.
Hi, Pooja. Thanks for inviting me for this podcast here on the air. I hope I will be able to solve most of your myths, and our audiences will take back some more knowledge on the hair care in the monsoon season.
We really wanted to dive into this topic before that, we wanted to know a little about your journey. What made you choose hair transplant and trichology as a specialization subject?
Yeah, Pooja, it was long back during my early years of training when I was doing my fellowship in cosmetic surgery. I was quite fascinated to see the artistry involved in creating a hairline, the fine job, the microsurgical work involved, where we do a baby handling of the grafts, taking out the grafts. They are just like babies and putting them in a way that looks more very natural. And the appreciation the patient used to get from their families and a boost in the confidence with the results, that was really quite fascinating, and that pulled me towards this field. And since last 15 years, we are regularly doing hair transplants, and we have just improvised on all the techniques and all, and we are getting such beautiful results. And I'm quite happy with what all we are doing and what all advances have been done in hair restoration, and it has really made a difference in lives of lot of people. You won't believe it has helped so many marriages from breaking, and it has helped so many couples to get together, because it really, although hair transplant is considered as not one of a important or a serious surgery, but believe me, it makes a lot of difference in the confidence of the patient or a bald patient who is suffering from hair loss.
Doctor, since you just highlighted about so many experiences, is there any memorable case that you'd like to share related to this topic?
There are quite couple of cases, but where, as I told you, like we have been able to save marriages, and we have been able to uh, get a boy, girl of our own choice, or a better match. But yeah, I remember one of my patients quite early in my journey of hair transplant, where he came to me. He was quite depressed. He didn't told me why he was depressed, but I could sense him. He was depressed, and he was too much concerned about the hair loss and all. And then we did his transplant as usual as any other transplants. And after 9 months, we followed him for 6 months, 9 months, and he got very good results. And then he came after 12 months with his wife and his daughter for meeting us, and then he offered me a box of sweet, and then he had just asked his wife to and kid to go out. And then he told me, sir, my marriage had broken, my wife had gone to back to his parents because I was depressed, I was not doing well in the job, and now with the gain in the confidence, I'm able to get my job back, I'm able to get my family back, and I'm so much thankful to you for doing this wonderful job for me. It has changed my life forever. So I still remember that the face of that person, and I really it really makes me feel proud of what work we are doing.
Clearly, so many emotions associated with hair care and so many more stories to have that hair back again. Doctor, since you spoke about hair transplant, so what are the different types of surgeries or measures that have been, implemented at your end for hair care and hair gain?
So, hair transplant is more for an advanced care of hair loss, for advanced grades of hair loss. So, someone who has already lost the hairs, and where medical treatments will not have much effect, then the role of hair transplant comes to cover a bald area. There are basically two techniques of hair transplant. follicular unit strip technique and the follicular unit excision technique. So most of the time now we are doing the follicular unit excision technique, which is the most recent and advanced technique and minimal invasive technique.
Doctor, when we talk about hair transplant happens when there is a hair loss. But how do we really define a hair loss?
So, see, normal human sheds around 50 to 100 hairs daily. So, that is normal, which everyone experiences because of the hair growth cycle, which has three phases: anagen, growing phase, catagen, resting, and telogen, shedding phase. So, every human goes through these three phases of the hair cycle and loses 50 to 100 hairs, which is a normal hair shedding. But yes, it becomes critical when you start losing more hairs, when you start seeing more hairs on your pillow, when you're brushing you are seeing more hairs, or during washing and combing you are seeing a bunch of hairs coming into your hand. So if you see any of these signs, it is not normal.
Doctor, once a patient or a viewer for that matter feels that there is hair loss happening, but what about baldness? What about alopecia? Anything that you want to highlight about that?
Now, the hair loss, which is also known as alopecia, it basically hair loss can happen in any region of the body. It can be from the scalp, it can from the beard or any other area. So that is basically alopecia. Now, there are two most common type of alopecia. The first is the androgenetic alopecia, which is commonly known as pattern hair loss and is the most common form of hair loss seen in men and women. In men, basically you start losing hairs from the front and in the crown area, and it eventually develops into a bald patch. And in females, the pattern hair loss, there is a diffuse hair loss with more involvement of the crown area and widening of the parting area. So this is the androgenetic alopecia, which happens mostly because of a genetic predisposition or a hereditary history in the family, or because of hormonal changes in the females during the menopause. The second most common form of alopecia is alopecia areata, which is an autoimmune disorder in which there are patches of hair loss which can develop in the scalp, which can develop on the beard. These patches or the alopecia areata happens because of unknown reasons. It can be because of the stress, it can be because of the nutritional deficiency. Sometimes in the extreme form of alopecia areata, you may lose hairs from the scalp, you may lose all the hairs from the scalp, eyebrow, eyelashes, and even the body. It is known as alopecia universalis.
So I think there's too much around alopecia clearly. But doctor, before getting into the surgery procedure that we spoke about, are there any hair nutrient therapies also that we have?
So, during the early stages of the hair fall, or before we start the medical treatment, the nutrient therapy and the changes in the lifestyle are advised to each and every patient of ours. So, basically, de stressing by meditation or the yoga, doing regular cardio exercises, which increases the blood supply to the scalp, avoiding straightening or other hair treatment procedures, and having a proper sleep and having a proper balanced diet. So these are the lifestyle changes which we advise to each and every patient who is facing the issue of hair thinning and hair loss. Now, coming specifically to the nutrients, yes, nutrients are one of the important part of the hair fall treatments. So we advise patients to have a balanced diet which is rich in multivitamins like vitamin A, vitamin C, vitamin D, vitamin E, and minerals like zinc, iron. And a high protein diet is advisable, especially in vegetarians. So most of the time, we advise them to take these vitamin supplements, and it really makes a difference. And it is an important part of the hair fall treatment.
Doctor, so I think for my viewers to know, you need to manage your stress, you need to manage and work out regularly, have the right nutrients balanced in. Doctor, I also wanted to ask, I recently picked up this nutrient supplement that I had been advised. I also got one for my partner as well. So just wanted you to share any highlights whether this is the right nutrition that we need.
Pooja, so as I can see the contents of the nutrients, it contains most of the essential nutrients: vitamin B, folic acid, biotin, and the minerals like iron, zinc. So I think it's quite an appropriate nutritional supplement for hair fall in women. So you can continue with it. I can recommend it to you. Regarding this nutritional supplement for the men, it contains DHT inhibitors like grapeseed extract, beta sitosterol, and it also contains the essential vitamins required for the hair growth like vitamin B, D, and the minerals. So yes, I can recommend this one for the men. So yes, you can continue with these vitamins.
Moving on, doctor, from hair nutrients, I've heard about hair transplant and hair weaving. So, which is the right treatment for whom? How do we really choose that?
So, hair transplant and hair weaving are two different ways to tackle hair loss. So, I will just give you a brief about both the procedures and their pros and cons. So, it is depends upon the viewer. It depends upon the patient to decide what is their requirement, what suits them most. So, hair transplant is basically a surgical procedure. It gives a permanent growth of the hair, and these hairs grow naturally. You can cut them, color them, and they will grow back again even if you shave it, and the hairline looks natural because it has been uh, artistically implanted over the scalp. So these are the benefits of the hair transplant. But yes, being a surgical procedure, it carries some risk. There is a risk of scarring, there is a risk of infection, there is a downtime involved of 7 days, 10 days off from your work. And then the transplanted hairs, they take a long time to grow. They start growing in 3 months, you see good density in 6 months, complete result in 9 to 10 months. And then transplant, the cost of the transplant being a surgical procedure is higher upfront, but yes, over the long term the maintenance cost is less because the results are permanent. So this is all about the benefits and cons about the hair transplant. Now, coming to hair weaving. Now, hair weaving is a procedure which is generally done in saloons, where they attach synthetic or natural hairs to your scalp, where they integrate either it by gluing or by weaving, where they attach these artificial hairs to your existing scalp or the hair. Now, this hair weaving is a very quick fix solution if someone wants an early results, doesn't have some commitments, and want a very good dense hairs, and without any risk or of surgery, without any downtime, and without and taking break from their schedule. So it's a good option for these kind of viewers or patients who wants a quick fix solution. But yes, see, it's not a permanent solution. The hair weaving, it requires regular maintenance. You need to go to the salon every month to get it cleaned and all, otherwise it can damage your existing hairs. Some people may get reactions because of the glue, the skin may develop eczema. So there can be some other secondary issues because of the hair weaving, and it's not a long term. You have to get the hair weaving changed every 6 months or 1 year. So there is a recurring cost involved with it. Yes, and the hairline what you get with the hair weaving is not that natural looking as you can get with the hair transplant. So these are some of the pros and cons of the hair weaving. So it depends upon what kind of solution you are looking for it. If someone is young and is looking for a long term solution, and wants more natural looking results, I would recommend him hair transplant. But if someone is in the middle age group, or someone who is just looking for some solution or some boost in confidence and wants a quick solution, has some medical issues like blood pressure, sugar, is not fit for the surgery, can go for hair weaving option also. So it all depends upon your requirements.
So I understood about hair transplant and hair weaving. But moving on, if we talk about those hair growth therapies, which are also very trending, I don't know how cost effective they are and how economical they are, and how effective will they really be for our viewers, especially if they opt for it. Anything that you want to highlight about it, please?
Pooja, it's a very interesting question, and that is the one of the most innovative field in hair restoration, because so many new therapies are coming, and which have very promising results. So it's a very highly evolving field, and we ourselves are learning a lot of things. Every new year, we are getting new therapies. There are PRP therapies, GFC therapies, mesotherapy, there are meso injections. So there are a lot of these therapies. Some of them are non-needle, and some of them are with needle or painless therapies. So there's a lot of innovation going on these treatments. But as per my personal experience, the most effective therapies of in the present time is the PRP and the GFC therapies. In this PRP therapy, we aspirate the patient's own blood, process it, and make serum which is rich in platelet concentrate, and then this serum or the plasma is injected into the patient's own scalp in the area of hair thinning. And these platelet concentrate, when injected, they release growth factors which stimulate the stem cells in the hair follicles and promote hair growth. So we have found it to be quite effective in early to moderate grades of hair thinning. Generally, 3 to 4 sessions are recommended at a monthly interval. But these all of these therapies have a very limited role in advanced grade of hair loss, or where the baldness has already set in, because there is permanent miniaturization of the hairs, and there the only option left is hair transplant. So it is always advisable to consult your physician or the hair transplant expert in early stages of hair thinning or hair loss, where the nutrient therapy, these plasma therapies can be effective, and you can avoid hair transplant.
Doctor, I had a question clearly for the youth, and baldness is starting right from the age of 18 these days. So, what is it, the kind of treatment that people from different age groups should choose? Is it like somebody who's under, 20 or 30 should go for PRP? I'd really like you to draw light on that.
Yeah, Pooja, it's very disturbing nowadays. Since last 5 years, we have seen these trends like youngsters, even age of 16 and 18, coming with the complaints of hair loss. Earlier, during our earlier practice, it didn't used to happen. But since last 5 years, we have noticed this trend of youngsters, even at the age of 16, 18, their parents bringing them, and they're concerned about the hair loss. So, what most commonly we have seen in them is that they had a hereditary predisposition. Someone in their family had hair loss, and that's why these youngsters have started losing hairs at an early age. And secondary factors like exam stress, interpersonal relationship stress, peer pressure, and the junk food, the poor nutritional habits of these youth, they have exaggerated the problem of the hair fall and the hair thinning, and have started at an early age. So yes, we need to act very quick on them. We need to act very aggressively on these youngsters. So we start them uh, with their hair, with their lifestyle therapies, where they ask them to avoid the junk food, have more healthy diet, have protein supplements, avoid late hours, avoid decrease the screen time, and then de-stressing habits and cardio and all. So we start them with these lifestyle changes, and we start them with the nutrient therapy. But yes, some of them, when they come, they are already in advanced grades of hair loss, like grade 3 and grade 4, where the hair thinning has already progressed beyond the early stage. And in those cases, then we need to start them with the medical treatments like minoxidil and finasteride. And yes, these therapies, they bring a lot of improvement in these youngsters when they continue it regularly, when they take it regularly. Regarding the interventional therapies like PRPs and hair transplant, we still try to avoid them before the age of 20. It's only after the age of 20, when their hair loss patterns have started maturing, we and if they are not responding fully to the medical treatment, we add these therapies like injection therapies, PRP and mesotherapies. And definitely hair transplant comes the last. It's only when they have total baldness and all, when someone comes with already bald scalp, then only we advise them directly for hair transplant. Otherwise, we definitely try them to treat them on the conservative treatments, medical treatment.
Doctor, there's a common worry that our people have, that will hair transplant really be effective, and is it really is it really painful, is something that my viewers would really like to know. And I'm sure there's a cost associated to it. So is it really worth the money that they're really spending on in a long term?
Hair transplant is one of the most gratifying cosmetic procedure, and it is one of the most common hair transplant which is the most common cosmetic surgery done worldwide, because it is a very safe procedure. The results are with a very high success rate and with a very high patient gratification. So yes, being surgery, there is some minor risk involved with it, and there is some downtime involved with it. But since it is done under local anesthesia, the patient is conscious throughout the procedure, the safety factor is quite high. There is no involvement of the critical organs of the body. It is just couple of numbing injections at the start of the procedure, which are given in the front of the scalp and back of the scalp to make the scalp numb, and that's it. That is what, just you will feel the pricks, and these are also very fine pricks done after applying a numbing cream, so which patient doesn't even remember at the end of the procedure, and he can just walk out of the operation theater at the end of the day and have his coffee or the food. And the results what he gets from the transplant, these results are permanent. They stay with him for all his life, and he doesn't need to take much extra care about it, so he can get maintain that hair volume for all his life.
I think it's not really difficult to take that one prick because it's all going to be worth it with the result that our people would get. So, Doctor, I think we've got a lot of information about hair transplant, hair care, hair weaving, and so much more. But any other message that you want to share with our viewers on this topic?
You should always consult a qualified hair transplant surgeon or a trichologist when you are planning for the procedure. You should always do your homework. You should read about the procedure, and you should discuss all your queries with the surgeon before embarking on the journey of the hair transplant. You should not just believe what you have heard or what you have read in the media. So do your research nicely. Clear all your doubts with your surgeon. You can research about the clinic. You can ask them for the before after pictures, and be sure that you are doing the surgery in the safe hands.
You very much for sharing all your valuable insights with us today at Hair on Air podcast series. I really want to thank you for your valuable time, for your amazing suggestions that are truly going to help a lot of viewers out there to get their dream hair back again. I'm sure, and I'm really looking forward for our viewers to probably be able to get in touch with you also, Doctor, to get these suggestions out in reality. Is there a way that our viewers can really reach out to you?
Pooja, we will be really happy to help out our viewers. If they have any more queries, they can feel free to contact us at our Instagram page, Harley's Clinic #01, or our website. Harley's Clinic, we have been in the hair restoration field for last 15 years. We have done more than 3,000 hair transplants, and we specialize in all range of hair treatments like PRP therapy, mesotherapy, BioFUE technique, and a follicular unit excision strip technique. So we have all range of hair therapies for all grades of hair loss, and we will be really happy to help out our viewers and their loved ones regarding their hair thinning or hair loss problems.
Doctor, we spoke a lot about hair treatments, hair nutrients, but let's look at the basics. Where does it start from? Anything that our viewers should be doing in their daily routine for their hair care?
Yes, Pooja, definitely. I think it's an important question, and I'm quite sure all of the viewers will be interested to listen about the basic hair care schedule. Yes, so if we follow a basic hair care schedule, it will help us a long way in maintaining the health of the hair. So basically, the oiling and shampooing. So you need to know which kind of oil suits your scalp. If you have an oily scalp, then you need a very light kind of an oil like a tea tree oil or an argan oil. If you have a dry scalp, then you need to choose a more thicker oil like a coconut oil or an olive oil or a castor oil. So you need to select the right type of oil which will suit your scalp. And the oiling, the frequency of the oiling, how often you should oil your scalp. So the right frequency is maybe 2 times a week is recommended oiling of the scalp, until otherwise you have a very dry scalp or a seborrheic scalp. Otherwise 2 times a week is quite a good frequency to oil your scalp. Then when should you oil your scalp? Oiling should preferably done just pre-wash, maybe an hour or two before the head bath. We maybe once in a week you can do overnight oiling also, but it is not very much encouraged because it can sometimes cause clogging of the pores and greasy sensation. So I will recommend oiling of the scalp 2 times, preferably pre-wash oiling and hour and two before. Now, next thing is the washing of the hairs. Now, selecting the right shampoo for you. You should avoid shampoos with more chemicals like sulfates and parabens. You should choose a mild shampoo which can cause less damage to the hairs. And you can wash your hairs 2 or 3 times a week, again depending upon the type of the scalp, depending upon your activities. If you have an oily scalp, you can wash it 3 or 4 times a week, but overwashing of the scalp has to be avoided because sometimes it just drains out all the oils and nutrients of the scalp. So on average 2 to 3 times washing with a mild shampoo is advisable. Sometimes those who are swimmers and those who vigorous physical activities, they can rinse their head daily, but too much of over shampooing has to be avoided. And after shampooing, you should try let the hairs dry by themselves. Try to avoid using too much of hair blow dryers and all. If you're in a hurry, you can use a blow dryer, but just keep it on the minimum settings. Use a wide bristles comb, wide teethed comb to comb your hairs to detangle your hairs, and avoid too much tight hairstyles, and uh, you should avoid too much sun exposure, harsh sun exposure. You should wear a hat if you are going to a beach side. And so these are the basic hair care schedules you should follow. Avoid too much of the straightening or perming or keratin procedures, because these all somehow damage the cuticle of the hair shaft and make the hairs dry and fizzy. So use conditioners every time you wash your hairs. You can even do a hair mask or a deep conditioning once a week, which will keep your hair soft and protect the cuticle. So these are the basic hair care schedules which you can follow, apart from a balanced nutrition diet, which we had already discussed earlier. And any more questions, if the viewers have, they can definitely write to us.
Thank you so much, Doctor. Thank you very much, all the viewers, for joining in on the Hair on Air podcast series. I'm sure you got a lot of answers to your questions on hair loss, hair care, and a lot of treatments around it. For more such information from renowned doctors across the nation, stay tuned on Hair on Air podcast series. We're available on YouTube, Instagram, Spotify, and Apple Podcasts. That's it for today. We'll be back again with another episode with another expert. Till then, take care, stay tuned. Ciao.